Welcome to Beauty Superstars Talk, your backstage pass to experts in beauty. My name is Miki Wright, and each and every week I have the privilege to interview Black beauty bosses who are doing amazing things in the beauty industry. We give voice to their stories and celebrate their excellence while they drop nuggets to help all of us become better beauty pros and better entrepreneurs. More than a podcast, this is a movement to encourage Black excellence, entrepreneurship, to preserve our history, and to bring healing to the beauty industry. Hello there. Welcome. My name is Miki Wright. I'm with beautysuperstars.com, and I'm your host for today on Beauty Superstars Talk, which is your backstage pass to experts in beauty. So I want to thank you for joining us. And when you mention beauty, it's hard not to think of health and beauty. And for many of us, we can sometimes take both for granted until they start to change. And today we are here to talk about your most valuable asset. You may be saying, maybe I don't have any stocks or bonds or other assets. Or you may think, well, I guess my most valuable asset is my home, right? But no, your most valuable asset is you and your ability to provide for your family. And it really is all about your health. And so the recent pandemic that we had really helped to shine a light on one of the biggest challenges that we face in the US, which is the health gap. And that's between African American and Hispanics and the general population. Whether it's finding quality health care, preventing or treating diseases that run rampant through the Black community, such as diabetes, heart disease, or cancer, or accessing affordable options for health care, insurance, and prescriptions. We really need an ally. And we are blessed here today to speak with an expert who is great here with asset protection for you and your loved ones. She's a healthcare advocate. Her name is Sandra Miller Jones, and she's passionate about providing solutions. She's also an insurance expert whose company specializes in affordable care, health insurance, Medicare, and final expense insurance. And so I am super honored to have you here today. And we'll, before I really jump right in and welcome you formally, just like to share a little bit about you. I'll share your bio and we will get started.
Thank
So
you so
welcome.
much, Mickey. I appreciate that.
You're very welcome. Mrs. Sandra Miller Jones is a longtime entrepreneur whose passion and corporate mission is to help improve the health of African American and Hispanic communities nationwide. After graduating cum laude from Howard University, Mrs. Jones went on to become one of the first African American women to receive an MBA from Northwestern University's top 10 Kellogg School of Management, and then the first female African American marketing executive for the Quaker Oats Company. Mrs. Jones left Quaker Oats in 1978 to establish SMSI, a national marketing services company that now has outreach teams in 35 major U.S. markets, operating under the banner of SMSI Healthy Living Solutions. SMSI's client list includes Procter & Gamble, Blue Cross and Blue Shield, Quaker Oats, Humana, AARP, General Mills, and many other national brands and organizations. Mrs. Jones is married to her business partner, Lafayette Jones, and the couple have one daughter, Dr. Bridget Jones Brooks, an orthodontist who lives in Atlanta with her husband, Patrick Brooks, and their son, Easton. So I want to welcome you. How are you, Sandy?
I'm doing well. Thank you so much. I'm glad you mentioned Easton. That's
Yeah.
our first grandchild. He'll be 1 year old, July the 23rd.
Oh, wow.
So
Coming up
we're,
quickly.
yeah, we're still excited about him.
Awesome. I bet you are. That's awesome. And you are quite a powerhouse. And so it's like I really am excited to have you here and for you to share with us today. It's like you have been in business for, it said 1978, so that's about 40
Yeah,
years. Is that
yeah,
accurate?
42 years now.
42. Oh, wow. It's like, congratulations.
Thank you.
So tell us more about SMSI. What exactly does it do, and how do you incorporate that with your passion for healthcare?
Yeah, so you noted that we are in 35 markets, and what we do is distribute information to constituents throughout the various markets in which we find ourselves. Information that's important to these constituents, as well as product samples, free product samples, we've distributed millions of free product samples over these many years. And we're privileged to be able to work with our community partners in order to get this done. So we've got about 10,000 churches, African American and Hispanic churches, and 40,000 beauty operators and beauty salons across the nation that we work with to help us. And we have a special affection for our beauty salon partners because they have just been so kind to us and so receptive throughout the years in helping us to reach their clientele with important information and with the free product samples that we're able to provide.
Yes, yes. It's like of course, my background is as a hairstylist, and it really is, we have the opportunity to interact with so many different people, and we really have a captive audience. And so I think it's such a great thing to be able to talk about something, of substance. We want to laugh and have the gossip and have a good time, but it's like when we really have that opportunity to impact, not only the health of the person sitting in our chairs, but the health of their families and the whole community. It's really powerful.
Yes, and that community does such good work in that regard,
Hmm.
such great advisors, and that's a wonderful thing. And we have to give a special thanks to Lafayette Jones, who's my husband and business partner, for getting us involved more intimately in the beauty industry. That's been his passion for many years as well. So that perhaps some of your listeners will know of the good work that he's done over the years in the beauty industry.
Yes, absolutely. It's like we salute Mr. Lafayette Jones, and I actually had the pleasure to interview him as well. So definitely, everyone can feel free to check out his history, his long history, and the accomplishments. Not only that he's done in the industry, but the contribution he's made to the industry with working with many of the top brands that you would recognize at the drop of a hat. So. We
Yes.
definitely commend him. And so tell us a little bit about the programs that you guys offer through SMSI. You have the Healthy Living Everyday initiative or programs
Yes.
that consist of.
In addition to distributing information through our networks and distributing samples, we've done education programs that include um, seminars on various health related topics and ambassadors. We've got community ambassadors who actually visit our venues and our gatekeepers to talk about some of the things that we know are important to our community. So we've done such things as some fun things like for Mrs. Dash, we talked about the importance of a low salt diet.
Hmm.
And in order to do that, we had chefs in multiple markets, African American chefs, to make spaghetti with Mrs. Dash and no salt.
Okay.
And then we distributed this spaghetti to 50,000 uh, gatekeepers and were able to get their endorsement to their constituents that it could be you can have some good food without putting some salt on it. So that was one of the many fun things that we've done.
That sounds delicious. I wish I had been there.
Yeah,
I love Mrs. Dash. So
yeah, good, good. For those people who don't know Mrs. Dash, it's a seasoning product
yeah,
that does not have salt in it. Yes.
yeah, and I love the garlic. That's my favorite. So.
Oh, great, great. Okay.
Yes, but tell us, like, how did you get involved with, or where did your passion come from for this, healthcare initiative?
Well, for healthcare, it's a passion that I've had throughout my life because my mother and father were people who volunteered in the community to do things that might be beneficial to our neighbors and friends. And one of the things that we always noticed was that there were so many health issues that were prevalent in our community, even when I was growing up as a child. And even in my family, my father had diabetes, my mother had heart disease. And so there are just lots of evidence of the need for some health education and some things that would help to reduce some of these incidences of these tragic diseases throughout our community.
Right.
And so when we started in business, we tried to do things always that could be helpful in reducing and health disparities. Was not a thing that we talked about then because we didn't realize that how great the disparities were, but just make things better in general.
Hmm.
But then over the last 10 years, we've started to focus very heavily on just improving the health of the communities in which we reach. And that's why we kind of changed our banner recently to Healthy Living Solutions from it was SMSI. SMSI stands for Segmented Marketing Services, Inc. So
Okay.
we changed our banner from Segmented Marketing Services to SMSI Healthy Living Solutions.
Yeah, that's incredible. It's like we definitely need it, and I think the gap. I don't know if it's gotten wider or not, or if we've just gotten more visibility about the health gap, but it definitely exists.
Yes, absolutely. There's tremendous disparities between our white counterparts and our ourselves as African Americans.
Right, right. Yes, absolutely. And it's like we talk about health insurance. Why is it important for people of all ages to have health insurance?
Because these health issues are so prevalent, and many studies have shown that people who have health insurance are less likely to be ill, to contract the diseases that are so prevalent among our population, and to die from them. And that's a really important
Right.
component of it. The life expectancy between African Americans and whites in the U.S. is broad now, and it increased within the time that COVID has been uh, a tremendous um, factor in our lives over the last 2 years.
Yeah.
Average African American lives to be about 73 years old, and the average white citizen lives to be about 78 years old now.
Wow.
You know, that's 5 years of life that
Right.
we need to try to gain on.
Absolutely. Yes. So we're here today to talk about Medicare, and it's like we have these conversations that could be a little scary to try to navigate and figure out. But I know there's confusion sometimes between Medicare and Medicaid. So can you clarify that for us?
Yes, Medicare is a government-run program that is usually for people that are over 65 years old,
Okay.
and it doesn't matter what your income is. If you're over 65, you probably will, and most likely will qualify for Medicare. Medicaid is a program where income does matter. So if you're in a lower income situation, or if you're disabled, um, then Medicaid is a program. Again, that's a government and state run program. So
Hmm.
U.S. government runs Medicare, and Medicaid is run by both the state and the U.S. government, and
Oh,
it is for lower income and um, disabled.
okay. Okay. I think that helps clarify it. So thank you for that. And we want to talk about Medicare. So why why do we want to talk about Medicare? What is the importance of that, and what happens to, I guess, many of us as we turn 65? You know, I've heard it's a have to, not an option. So tell us from your experience what that looks like.
Right. So much confusion about Medicare. When people are turning 65, they get so many messages. Some of them are clear and some of them are not. And so, one of the most important things is to try to give people some clarification as to what is Medicare and what can you do and what do you have to do to make sure that you're you do have Medicare eligibility. But let me just talk about Medicare in general, first of all. Um, there are three ways that Medicare can be provided. You can do, uh, when you're 65 years old, if you have worked at least 10 years throughout your um, lifespan of work history, um,
Okay.
then you are, and pay, and your employer, if you or your employer paid into the Medicare system, then you're eligible for Medicare.
Okay.
There's original Medicare, and original Medicare covers both your hospitalization. That's where they talk about these various parts of Medicare. So Part A covers hospitalization and hospital expenses, and Part B covers your doctor's expenses and related doctor's expenses. So that's Part A and B. You automatically get Part A if you've worked the 10 years, like I said. Part B, you have to pay the government for, and you will automatically get it, but you have to pay for it. This year, and most people have it taken out of their Social Security benefits. So this year, the cost out of your Social Security benefit of Part B is about $160 a month. So whatever your Social Security amount is, $160 is going to be taken out to cover your Part B. So if you just have basic
Okay.
Medicare, you get Part A and Part B with your paying Part B. However, your basic Medicare only covers 80% of your expenses. So that means that 20% of your expenses you're going to have to come out of pocket for, unless you have another kind of Medicare service to assist with that expense. So you can have original Medicare, and then you could add to your original Medicare um, a Medicare supplement. That's not any of the parts. Medicare supplement is not Part A or B or anything. It's
Oh,
just a supplement that goes with your original Medicare, and that supplement helps to cover that 20% of the cost.
okay. So can we just pause there? I just want to make sure
Yes.
everyone's clear. So we've got when we turn 65, if we work 10 years or more in our career or lifetime, then we would be Medicare eligible and we
Yes.
would receive Part A automatically. And we would receive Part B automatically, but we have to pay for Part B. And typically that's going to come out of your Social Security check.
Yes.
Okay.
Yes, you got it. That's
Okay.
exactly right. Yes.
And A and B together only cover 80% of your expenses. And so the rest, if we want that covered, not coming directly out of our pocket, we need to consider a supplement.
Right. Right.
Okay. Okay. So take it from
All
here.
right. Okay. So the supplement, if you decide you want to consider a supplement, you have to pay for the supplement as well.
Okay.
And um, original Medicare does not provide drug coverage. So then you'd have to buy also a drug coverage plan. And it's required that you have a drug coverage plan. So you're going to have to get it.
Wow. Okay.
There are some exceptions. Let me just say that there's always some exceptions to everything. So those are the exceptions. When you actually get into the details, you have to look for those exceptions as well. So
Okay.
you got Part A and B, and then you got a supplement to pay for, and then you got a drug plan to pay for. That's one thing. Now, Part C. Part C is what they call Medicare Advantage. And this is, again, this is the supplement you buy from private insurance companies. Medicare Advantage is provided by private insurance companies.
Okay.
And Medicare Advantage covers all the parts: Part A, Part B, and drug coverage, which is Part D. That's drug coverage. So
Okay.
all of that is wrapped up into one policy, and the government pays the private insurance company to manage your Part A and Part B, manage your hospitalization, manage your doctor's care, manage the things that go along with each of those. Medicare Advantage plans must provide everything that original Medicare provides. So,
Okay.
so if you're gonna your Medicare Advantage plans have become extremely popular because they're very competitive, as you can see from all of the ads that you see on TV.
Right.
But these Medicare Advantage plans, you can get a Medicare Advantage plan that doesn't require you to pay any extra premium. You don't have
Mhm.
to pay anything to the insurance company. You can get one and a good one,
Okay.
and you don't have to pay for the drug coverage in your Medicare Advantage plan. So, if possible, then you'll be looking for a Medicare Advantage plan that you don't have to pay any premium to the insurance company for, that gives you your drug coverage at no incremental cost,
Mm.
and that gives you some other extra things as well. Uh,
Okay.
so, so yeah, look very carefully at Medicare Advantage if you're looking for some Medicare coverage.
Okay.
If you must have Part A and Part B in order to get a Medicare Advantage plan. So
Okay.
yes, because that's that Part B amount of money that you're paying
Uh-huh.
that's being sent to the insurance companies. So,
Okay.
so
Okay. So
that
you still
they can,
still pay the Part B, but it's
right,
being sent there. Okay.
but
Okay.
no, nothing extra. Yeah.
Got it. Okay.
Yeah. So
Okay. So what about things like I don't think those things that you mentioned cover things like vision and dental. What
yeah,
about those type of, I don't know, supplements, if you will?
uh-huh. If you get a, the right Medicare Advantage plan,
Okay.
it will include basic dental and basic vision. And when I say basic, that's for dental, for example, that's 2 cleanings a year, and the X-rays that go with that. That's
Got
basic.
okay.
And
Okay.
basic vision is some your once a year getting your exam,
Okay.
and some kind of subsidy for your lenses and your frames. That's basic.
Got it. Okay. Okay. So are there any other options to have more than basic, or that those are pretty much the options and everything else would be kind of out of pocket?
Uh-huh. You can buy incremental dental plan,
Okay.
and you could buy an incremental vision plan as well. But there
Okay.
are not a lot of vision plans that cover more than basic.
Got it. Okay. Okay.
Dental plans can cover a lot more.
Okay. So how does the process work? It's like, okay, we've got some folks out there that are maybe 63, maybe 64, and it's like, what in the world is going to happen in the next, year or so?
Right. If you qualify for Medicare, Medicare will start to send you information as early as 6 months, and certainly no later than 3 months before your 65th birthday.
Okay.
So they'll send you to let you know whether or not you qualify,
Okay.
and
Okay.
then you'll know. But if you are really concerned and want to get some information early, you can always call 1-800. Not Yes, you can call them 1-800 Medicare,
Okay.
or go online to Medicare.gov,
Okay.
and you could get some early information. You could call us, but we don't know what your particular situation is. So,
Right. Right. And so is that really the advantage of working with, with you or someone like you for that assistance? Because, it's like you say Medicare Advantage, and it's like, okay, that sounds like a good thing. But, with everybody, their situation's going to be individual. And how do we know which plan is going to be the best for our situation?
yes, yes, you're absolutely right. Working with a certified, licensed uh, agent who has studied all of this information, and who has various clients that they work with, rather than just to dedicate somebody. Well, you could do either of them. I don't want to say that people who just work with one
Mhm.
plan can't be objective, but they could be. But if a person works with a number of different companies,
Hmm.
Humana and Blue Cross Blue Shield and um, Aetna and Cigna. Those are the top ones.
Okay.
Then they can compare for you the different options. And for Medicare, for Medicare Advantage plans, there are different options based on the state and the county in which you live.
Wow.
You live.
We need some
Yeah,
help, right?
yeah,
Navigating all of that.
yeah, exactly. Uh-huh.
Yeah, it's pretty interesting, just hearing it all broken down. So we definitely appreciate you making it simple for us.
Mhm.
So, it's like if we don't have someone that we're working with or someone in our area, it's like how can we contact you or your company to help assist us with that process?
Yes, again, just give us a call at 336-759-7477 and
Okay.
leave a message and we'll get back to you within the day.
Awesome. Yeah, and that is scrolling right below, so you can take those numbers down. Will you repeat it for us, please?
Sure. 336-759-7477.
Awesome. Okay. Yeah. So we will definitely, I think we'll be giving you a call to see what the best options are because it sounds like there's quite a few options.
Yeah,
And, like when you say that it's like even broken down by state and county, it's like, wow, how do we begin this
yes,
process?
yeah.
So, are there any other things that someone should know about Medicare? Before we start the process or information you might need for us to, be ready to provide?
Yes, you should really try to get started about 3 months prior to your birthday,
Okay.
your 61st, 65th birthday.
Okay.
Because if you have sometimes if you're employed and your employer has been paying your Part B portion of your Medicare,
Mhm.
and then when you retire or leave your job, then you may have to start paying it. And if
Mhm.
that's the case, you're going to have to sign up for it, and so that could be take some time.
Okay. Okay. And many of us, I'm obviously in the beauty industry, we work independently, we may be self-employed, we may be business owners, all of those things. And of course, there's so many people that are just part of the gig economy right now in the
That's
US.
right.
And so, are there any special things that we may need to consider?
No, I again start 3 months before
Okay.
your birthday because then you can see if there are things that have to be considered because you're a self-employed person or, as you say, a part of the gig economy.
Okay.
Yeah.
Okay. And you spoke about Social Security. It's like if we're in a position where we're not getting Social Security, do we still need Medicare?
Yes, you still need Medicare.
Okay.
Yes,
Okay.
yes, and you can instead of the money coming out of your Social Security check, then you can pay directly for
Okay.
the coverage that you need.
Okay. Okay. Well, this is definitely eye-opening to see how this whole process works. And is there anything else that you'd like to add about it?
Mm, I don't think so. I think that those are the basic things. It depends so very much on an individual's um, unique situation
Hmm.
that it's dangerous to do too much generalization,
Right.
and that's why it's dangerous to listen to commercials that don't have too much specifics. I know that one of the things that I guess I should add that you need to be based on your income. There's often an opportunity to get help from your state to pay for your Part B
Mm.
premium, and therefore it wouldn't
Okay.
have to come out of your Social Security. So and that's probably the only generalization that I think would be safe to make.
Okay. Well,
Mhm.
that's good to know. That's good to know. But definitely, it sounds like we need to have an expert, which we value. Um, the opinion of and the experience of.
Yes, Mickey, I think that that's extremely important for Medicare um,
Mm-hmm.
recipients. Nobody, for example, is supposed to call you to solicit your business on Medicare. There's a law against that. They
Mm.
can send you a postcard, a mailer, but they can't call you unsolicited
Okay.
to ask you to be a client of theirs.
Okay. Yeah, definitely we need to know that.
Right.
So,
Right. And also, before you start to work with anyone, even though you might trust them very much, they have to get your written permission, and there's a form that has to be filled out to say that you agree to have them talk to you about Medicare.
okay.
So, right. So make sure that that form is provided and on file.
Okay. So many things that, we just don't know. It's like it's not taught anywhere, it's not discussed anywhere. So we definitely appreciate you really taking us through this, step by step and taking a lot of the confusion out of it because it is like what? Yes. So, yeah, I want to thank you for being here with us today. And again, tell us, how we can contact you should we have any further questions. And, you offer final expense insurance as well as Affordable Act or Affordable Care Act insurance. And so
Obamacare.
Obamacare. And so tell us how we can, contact you and, have some conversations about what those things may look like and mean for ourselves and for our family.
Yes, just call us at 336 That's 336-759-7477. And just leave us a message and we'll get back to you in a day.
Wow, that sounds great. So thank you so much. It's like you're doing such great work for the community and, really walking us through this journey, which, we're all lucky, I guess you could say. It's like we will be crossing into, dealing with Medicare and getting it set up. And we would definitely want to make the best decisions for ourselves and to be able to move forward with that. So,
Yes,
again,
and we thank you, Mickey, for the excellent work that you do,
oh,
the
thank
service that you provide. We really do appreciate it. I've heard such good things
you.
about the services that you have provided.
Yeah, well, thank you so much. It's like I've been in this industry for so long. I'm definitely committed to the success of the people in it and being able to, be a salon business coach to have beauty superstars talk, where we actually get to have these conversations that are much needed in our community. And done over 80 interviews and
Oh, my.
with
Wow.
beauty bosses, and so there's a large library. So for anyone who's
Yes.
interested, you can check them out, including my interview with Lafayette Jones on my YouTube channel, which is Miki Wright, and it's just Miki. Just everyone always wants to give me extra letters, but just Miki Wright on YouTube, or you can catch me at beautysuperstars.com.
Wonderful.
So,
Wonderful.
yeah, yeah. So I appreciate this opportunity and definitely look forward to hearing, what's going forward, what we need to continue to look at because I know things are always changing.
Oh, yes, absolutely. Mhm.
Yes, yes. So thank you so much. I want to thank everyone who's been here with us. We appreciate you and your time and encourage you to keep reaching for the stars. Miki Wright with beautysuperstars.com. I help hairstylists go from struggling to superstar and look forward to seeing you next time.